Hi, it's Dr. Paul Goldberg at the Goldberg Clinic, and I have the pleasure today of being with Miss Gail Trenley. And Gail's just returned to see us after 3 months of being on a program here at the clinic. She's from Wentzville, Missouri, not too far from St. Louis, right?
Right.
And Gail came to us originally due to having problems with, well, Gail, tell us what problems you originally had that brought you to the Goldberg Clinic.
Well,
What had you been diagnosed with?
I have been diagnosed with multiple sclerosis.
Diagnosed with multiple sclerosis.
And I had a lot of fatigue issues, concentration, just felt foggy. And then I was also having some weight issues. I don't know, because I was on 3 different drugs at one time. I don't know if the drugs were causing
You were on
it.
drugs that were specifically given to you by a neurologist for the diagnosis of multiple sclerosis.
Yes.
Okay. And how did you feel when you first came in to see us?
Just kind of sluggish, and I was having a lot of trouble concentrating, staying on task, I guess. That's, overweight.
You're overweight.
Yeah.
And you were feeling...
and I was having hives daily. I was having hives. My lips would swell up sometimes, my eyes, my face. I got them on my body constantly, my hands, And I had some skin issues. I had little bumps on my legs and my arms. And I had the little bumps on my arms and stuff for as long as I can ever remember, and my whole life, and fever blisters. I've been getting fever blisters all my life, but the older I got, the more fever blisters I got, and I had a lot of mouth sores. There was hardly a day that went by that I didn't have some sort of sore in my mouth or on my tongue or on the outside of my lip. And I started going through, I think, menopause this last year, because I hadn't been having periods, and I was eating a lot of ice cream to make myself feel happy. I think.
Was it working?
Well, while I was eating the ice cream, I felt happy, but I don't know if it was working necessarily.
It didn't have a good long-term effect.
No. But it did feel good on my mouth, because, I always had these sores in my mouth.
Mm-hmm.
And now I don't have mouth sores. I haven't had one.
And so you don't have to eat ice cream for your mouth sores anymore?
No, I don't. I don't even, almost, in fact, I wouldn't eat chips very often, because usually my mouth hurts so much. I wouldn't eat things that scraped my mouth, so.
What's the program we put you on? We put you on a dietary regimen.
Right.
We told you to go out in the sun.
Right.
We talked to you about rest and sleep habits.
Right.
We gave you a very few supplements to take.
Right.
Right?
Mm-hmm.
We had checked a number of different things on you. Have you taken any drugs at all?
No.
Have you done anything really strange or exotic?
No.
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 And I want to ask you this question very objectively. Did we tell you that we were treating your multiple sclerosis?
No.
No. And yet the symptoms of your multiple sclerosis have diminished, have they not?
Yes.
Yes,
Well,
they have.
I feel like I can concentrate a little better, and the fogginess, the brain fog, I think is actually gone.
I'm sure that's a relief to have that gone away.
And then the hives have. I know my neurologist told me to stop taking the Rebif in June, but I was still getting hives, and the hives are completely gone. I haven't had any hives. My skin is smooth. It's really soft.
Did we do anything to treat your skin?
No.
No.
And
Did we do anything to treat your hives?
no.
I'm asking you rhetorical
No,
questions.
we did not. And I don't have any sores in my mouth, which is amazing.
Because what we're doing, I should say what you're doing is you're rebuilding your body from the ground up now.
Right.
So it's been about 3 months, you've had a reversal of your symptoms of multiple sclerosis and the hives and the other problems you have, the brain fog has cleared, and what's really happening is gradually the old cells of your body are now being replaced just through good hygienic measures specified and individualized for you.
Mm-hmm.
And as we were just discussing just before we started shooting this video of you, is that over the next year, this process will continue with things that you're learning here.
Right.
And you can continue to get your blood will be replaced, your cells of your liver and your heart and all these different body organs and glands will be replaced. and that will allow you to continue to have good health. And most importantly, is that you're now going to be able to take control over your own health rather than being dependent on your neurologist, or for that matter, being dependent on me.
Right.
You're going to be able to take control over your own health. And did you say you lost some weight?
I did. I've lost, how much? 30 pounds?
About 30 pounds.
Yeah.
Did I tell you I was putting you on a weight loss program?
No.
No, I didn't.
In fact, every time I would email, they'd say, "You're not on a weight loss program."
Every time you email with Dr. Tenner.
Yes, every time I email Dr. Tenner, he'd
Right.
say, we're just trying to get your
We're-
cells healthy.
We're trying to create the right conditions for good health.
Yeah, for good health.
That's right. Well, I'm very, very happy about your improvements, which have been significant. And I think, as we just talked about before we shot the video, you're going to continue to see even more improvements as time goes on.
I hope so. Good.
Thanks so much, Gail.
Thanks.